Hi, I'm Robin Forster with Feel So Alive and Feel So Alive Informed, and that's what this program is. And just to let you know, I'll be looking down at my notes now and then just to keep me on track because I value your time and I don't want to waste any of it by getting lost. So that is the plan. Um, Today, this program is a little bit different, and we'll talk about that as we go. We're going to do a deep dive into just one topic, which is trigeminal neuralgia, which is a very weird disease, to put it mildly. It's also very frustrating. And so my guest today is Dr. Megan Daly, and I'll introduce her in just a little bit. She and I started talking about TN because I have it, and she has been working on some things, the vagus nerve. Um, and so, well, let's just get the program started so then we can dive into the deep dive because I think that you will find that it's pretty fascinating. So our guest today, as I was telling you, is Dr. Megan Daly, and you're going to hear some of her bio. She was on our program March 11th, if you want to go back and look at that. And we just had so much fun and just went down so many rabbit holes that I had to have her back. So that's what's happening today. As I said, this is a little bit different. Normally how this program runs is that I interview a healer. It's more like a chat for about 10 minutes. And then I also interview a business person with some tips and suggestions. And both of my guests always are giving as many ideas and suggestions and tips, things that they have tried and used to share with us. Because why not pay it forward and pass it on? So that's what this program is all about. But today, as I was telling you earlier, it's all about trigeminal neuralgia and figuring out some alternatives, some ways that we can help ourselves. But before we do that, the world is still in a very wonky place, and I know that we all know that. And so as part of giving back and centering ourselves and being present, I would like to ask you if you would just give 30 seconds of quiet, and you can do a blessing if you want, a prayer, silence, send white light, whatever it is that you feel comfortable with. So that is the next thing that we'll be doing here. If I can get the thing to switch. In case you're wondering, I'm a solo entrepreneur, so I've been learning lots about eCam, the program that I'm using, and I also have lots more to learn about it. And my latest new toy is a Stream Deck. So if you're curious about the behind the scenes, let me know and we can chat. So let's go into our silence. Thank you very much. And now on to our deep dive with Megan. Hi, I'm Robin Forster with Feel So Alive and Feel So Alive Informed. And today we have a special program, and I want to introduce my friend Megan Daly. Megan, you want to say hi?
Hello.
Excellent, thanks. And today we're going to be talking about trigeminal neuralgia, which is basically a very strange disease that folks have. And Megan has this vast, well, okay, let me give you the bio on Megan because that will really help to explain what's going on. So Megan has, oh, I'm going to be looking down at my notes, just so you know. Megan, with 8 years of PT practice, has great tips for folks on migraines and dizziness, which is her specialty. And then we're going to get into the vagus nerve. She is a PT, a DPT, a CHC. She's experienced in physical therapist and a health coach. And some of those initials mean that she's a doctor of physical therapy. And she also has a certificate in vestibular rehabilitation. Did I say that right?
Yes.
Oh, good. Okay, great. And she likes helping patients regain control of their lives because when you're dizzy or you have migraines, it just impacts your whole life so much. She currently has her own mobile physical therapy coaching practice and is co-owner of Dizzy Coaches, a vestibular mentoring program for all levels of vestibular healthcare providers. She has experienced many of these conditions personally and brings that empathy to all of her client interactions. So, Megan, did I kind of cover the high spots on your bio?
Yes, definitely. That was great, Robin.
Awesome. Okay. So let's get into trigeminal neuralgia because I'm sure that the folks watching this on the replay are going to either be wondering what it is because they'd never heard of it, or it's going to be people who are affected by it and are looking to see if there's anything new, any suggestions. So why don't we start with you explaining what it is?
Yes. So trigeminal neuralgia, we can break that down, break the words down. So neuralgia means nerve pain. And the trigeminal nerve is a nerve that comes around kind of from the ear, and then it comes across your face in three main areas. So you've got the ophthalmic branch, which is around the eye, and then you've got the maxillary branch, which is to the maxilla, so the upper mouth, and then you've got the mandibular portion, which is around the jaw, the lower part of your mouth. And you've got that, all three of those on both sides. You've got two trigeminal nerves that come down, one on the right and one on the left. And so what happens is you can get nerve pain, and this can happen sometimes from compression. If there's a blood vessel that's touching the nerve or something else that's restricting that space, then you'll feel that pain. Most commonly, you'll feel it down here in the maxillary branch or in the mandibular branch. It's less likely to happen up above. And this is important because the trigeminal nerve is sensation for your face. So if you touch your forehead or your cheeks or down here, that's all your trigeminal nerve doing the work. So when you have nerve pain, you're just getting that extra signal there that can be very, like you said, that you were calling it the dragon. So it's very uncomfortable.
And when we were talking before we started filming, I do have trigeminal neuralgia, and Megan knows this. We've talked about it before, and when I found out what she knew, and it's kind of weird to say that in third person because we're right here hanging out together. But when I found out what you knew, it was like, oh, great. Okay, let's share this because it's the kind of disease, I guess is the right name for it, that it's very hard to deal with, and there's, quote, no cure. But there are a lot of things that we can do. So before we get into that, can you talk about how people figure out that that's what they have? Because I know it took me years to figure it out.
Yeah, it's definitely one that can be harder to diagnose. It can often be missed, especially if the pain is intermittent, because sometimes there really isn't a pattern to it. The trigeminal nerve also helps with chewing. So sometimes people will feel it then. And so it can be hard to differentiate where exactly the pain is coming from. Sometimes they'll look at the TMJ, that joint, the jaw joint instead. So it can get missed that way. And it can just be unpredictable. So just having symptoms, pain kind of off and on in the face can be hard to diagnose. Some people can also experience like muscle spasms or tics. And so unfortunately, sometimes people get written off as saying this is all in your head. It's just anxiety or it's a psychological condition and it gets overlooked, or it just kind of gets dismissed as, well, if it only happens every once in a while, then, it's not really a big deal. But as we've talked about, it can be very, very much a big deal and interfere with your life.
It can, and that's a piece that I think is so important is the pain level. Because sometimes, on a scale of like 0 to 1, where 0 is no pain, or 0 to 10, and 10 is extreme pain, sometimes for folks with TN, the pain is at like a Mach 20.
Mm-hmm.
It's totally off the scale. And
Right.
trying to describe that to somebody, because I remember one time I was getting ready to walk up the stairs, no big deal, And the pain was so intense that I had to stop and focus on breathing because I was holding my breath because, I mean, it hurt, you know, it wasn't fun. And so I think that's a piece that people don't really realize, even though you're looking at somebody, nothing's happening to the face, doesn't look any different, but their eyes are going wonky because they're in so much pain.
Right.
I shouldn't laugh. It's serious, but
Yeah.
yeah.
Yeah, because that can come out of nowhere, and they can do imaging and things like that, and it doesn't show up necessarily on that. So it can be that, hard to diagnose when you just have this sudden pain out of nowhere and then it goes away again, and it's hard to pinpoint where that's happening.
Yeah, exactly. Yeah, thank you for saying that because a lot of times I think those of us who have it's like, well, are we really crazy? Well, we're not because that really hurt. And so, I mean, and I didn't do anything. I was just standing here talking, and all of a sudden, the dragon appeared. And so, yeah. So let's see. Why don't you talk a little bit more? I'm looking down at my notes again. Why don't you talk a little bit more about the vagus nerve? Because, I mean, that is such a key, and no one really talks about it.
Mm-hmm. Yeah, so the trigeminal nerve and the vagus nerve are both what we call cranial nerves. So these are the nerves that are around your head and your face. And the trigeminal nerve is the largest nerve of those. There's 12 of them. And then the vagus nerve is the longest nerve. So the vagus nerve goes all the way down into all of your organs. And it really helps control your overall nervous system and helps you kind of end up in that rest and digest area. So that we can split the nervous system up into two portions. So there's your fight or flight, which is kind of that active and alert response. And then there's the relaxed state, which is the rest and digest. And so if you've got irritation, if you've got pain, that's going to push you into that fight or flight response. And then it's going to be really important to activate that vagus nerve to help calm down your system and get you back into that rest and digest phase.
Oh, I'm glad that you said that because I would have thought that we wanted to deactivate the vagus nerve. So I had it totally backwards. So we want to activate it so we can get into rest and digest.
Yes.
Okay, that helps a lot.
Yes, because that can help also control inflammation. So there's some neat little vagus exercises that you can do to activate it.
Oh, good. Okay, so hold that thought because we need to definitely go into those things.
Yeah.
And especially the inflammation piece and watching what we eat and our exercise, but we'll hold those thoughts too because you had some options for treatment that I think you wanted to go through first.
Mm-hmm. Yeah, so I know it's hard sometimes to get a diagnosis, and this seems like such an overwhelming thing. That can be a big stressor right there. But then once you get the diagnosis, that can also be stressful too. So it depends on what you're looking at. Sometimes people feel hopeless when they find out. But there's a number of things that you can do, and it's definitely trial and error. It takes some effort, but there's a lot of different options out there to help with trigeminal neuralgia. So typically the first thing that your physician might do is try some medications, and that's outside of my scope, but people have success with those medications. And then when I'm looking at it from a physical therapy standpoint, we're going to look at all the movement in your face. So looking at the jaw, the joints, looking at the muscles. Is there anything there? Is it tight? Are you grinding or clenching at night? Because that can sometimes trigger the pain and the compression on the nerve. So there's a couple techniques that we can do in physical therapy. And one of those is doing electrical stimulation. So like a TENS unit or little microcurrents, and those can help with that nerve pain. There's also neck exercises that we can do because the neck is so close to the face, right? So making sure that all of that is working smoothly and that your muscles and joints are in their best position and for comfort. And then also there's facial mobilization. So there's just like we would work on an arm or a leg or a back and mobilize it, you can also do that on the face. And so some physical therapists are specifically trained in it. You can also do, there's a number of different providers that will do that sort of mobilization. So there's osteopaths that do it. You can also do some craniosacral therapy, and they will do the mobilizations around your face and around your mouth.
Great. Yeah, and I think that you gave me the name of a person for
Mhm.
cranial sacral, and I'm working on getting in touch with her because,
Nice.
yeah, I would love to interview her because it's kind of like, okay, that's the next piece, in this puzzle. So that would be awesome. Let's see, we were going to talk a little bit about breathing exercises and nutritional changes. And there is a book that, and I apologize for not getting it down ahead of time,
Mhm.
that was really, really good talking about this. And I'm not seeing it on my bookshelf.